So taking the splint off at 1 week post-op is something very common for all of us rhinoplasty surgeons. And I wanted to show how we take it off. It's very simple, but at the same time, tricky as well. One thing you can do is tell your patients that you have to keep it dry, but the day you come, that morning, get in the shower and let it get wet. Let it get soaked, and then when you come in, it's going to be loose and it'll make your life easy. So to take it out, one tool that is really good actually is a cerumen curette, which is a little tiny instrument that we use to take wax out of the ear right there. And you have to do it very gently, and I'm going to show you exactly how. So as you come in here, what we're doing is we're trying to just lift this from the skin. So right there we go, very carefully. So watch for the eye, and you're going underneath there slowly and gradually, because remember, the broken bones hurt, and you want to be as gentle as possible, and just slowly releasing it. There we go. Fantastic. So it's a slow progression. You don't have to be aggressive because you don't want to hurt the patient. Just slowly and gradually, and making sure you're getting everywhere. All there. Great. Slowly. This is especially important to be careful if you have done the open rhinoplasty, because you don't want to lift it upwards. You don't want any stress on these sutures. Or if you've done alarplasty in the suture, so you have to be extra careful. This is closed, so this is relatively safe. So we continue to do this slowly and gradually. It's a lot easier to just go from the side, and you can see coming out from the side right there. You can go all the way up. You can see it coming out. Same thing over here. We can go all the way up very gently. Gonna come close to the eye and slowly. Literally, it's almost like a butter knife, going through butter very gently and carefully. So you can gently lift. You can see it happening right there. So if you have, I think pretty much always bring it down this way, because that'll make it less likely that you pull on the stitches here if you have any hair, or on the nostrils. So you go right here, release it a little bit more, and you can see it coming off. There we go. If there's resistance, don't push, just keep working on it. Or you can always use the hydrogen peroxide spray as well to loosen it up. You're going slowly and gradually, and there we go. Lifting. Okay. So now, gently lifting. There we go. Next thing what we are doing is taking this off. There we go. Perfect. So now we are done. And after this, we are going to show it to the patient and then see what the patient has to say. So very good. Yeah. One more. Good. So there you go. That's your nose.
Oh my gosh.
You can use two if you want. Remember, like I showed you before,
yes.
surgery from the side as well?
Yes. I like it. Very different.
Different. That's what we wanted. We wanted it different, right?
Yes.
And you're very lucky. You didn't have any bruising at all.
Yeah.
No bruising.
¿Cómo se siente?
Me siento súper.
¿Y tiene algún dolor?
No tuve ningún dolor desde el principio, todo fue bien, no tuve dolor, no tuve que tomar pastillas para el dolor. El doctor tiene buenas manos, lo recomiendo 100%. Estoy muy feliz.